Is everyone able to see the presentation slides?
Yes.
Awesome. All right, well, why don't we get started? It is officially 6:05. Good evening and welcome everyone to the full quarterly Prince George's County Health Action Coalition meeting. I have Dr. Stacy Little with us today, our wonderful co-chair who will give us our official welcome. But again, just as you enter, again, please just type your name and organization in the chat box so we know you're here. And a reminder again that this meeting is being recorded, but thank you all for your participation today. Dr. Little?
Well, I don't know how official this is, but I'm always grateful for individuals who are able to take time out of their schedules and participate on the coalition and come to these meetings. We have a jam-packed agenda, lots of information to share, things that I'm sure you're interested in learning more about. And so this is really what this meeting is all about, us, sharing information and making sure that we're addressing issues that are going to improve the public health and wellness of our residents, our families, and our communities, and our youth, and our, who we are. We live here. So this is really important to us. So anyway, I'm not going to just stammer on. Let's keep it moving. And we'll go on to our next agenda item, which I believe is going to be Taylor with the new coalition manager introduction.
Well, before we jump into that, I'm actually just going to go ahead and do a brief review of the vision and mission statement. So yes, to Dr. Little's point, we do have a full agenda, but I just want to take this moment to remind everyone of our mission, vision, and values. The health department is working towards a vision that all Prince Georgians are their healthiest at every age and every stage. So just thank you all for helping us advance this vision and mission to lead, engage, and empower our community to work collaboratively towards disease prevention, health equity, and overall well-being. By supporting this work, you are not only moving our vision and mission forward, but you are also helping us live out our values in the community. These values that are grounded in equity, diversity, and inclusivity, respect, teamwork, accountability, innovation, and excellence. So let's just do a quick review of the agenda. Shortly after this review, we will have Taylor come, excuse me, to introduce the new coalition manager. That's me. But following that, Olo will provide some higher level updates regarding recent leadership transitions that have happened. We will then have Deborah come and share some really important updates about the community health assessment, or the CHA, and she'll share some key findings on how to best utilize this report. And then we have our wonderful co-chairs who are going to come and share some updates on the efforts that each work group has been making, particularly this past quarter, really this past year, and then close with some community announcements before we adjourn. So that sounds good to everybody. We'll go ahead and move on. At this time, I would like to ask Taylor to come and introduce the coalition manager.
Hey everyone, good evening. So good to see some familiar faces. To echo Dr. Little and Shanae, thank you all for your time, for being so gracious to join us right here at the dinner hour. Really appreciate everyone joining us and continuing to show up for our coalition. It has been a busy season of change, but good change, and we are very excited to welcome Ms. Shanae Vicks as the new manager of the Prince George's Health Action Coalition. As you can see how effortless she presented the health department's mission, vision, and values. She is already a very proud Prince Georgian health department worker. So she is already living and breathing our mission and vision. And she has just brought such great energy to the coalition. She's met with our co-chairs, and she is just a really well fit coming in and talking about how to elevate all of the wonderful work that you are all doing. So you can see Shanae's bio up here. If you haven't met Shanae yet, I highly recommend you all schedule a time to meet with her. We can make sure that her contact information is there in the chat. But overall, Shanae is just a wonderful change agent. She is always advocating for health equity. In every single meeting I've been with Shanae so far, she said, what about equity? How can we make this more equitable? How can we make this better for Prince Georgians? So she is living, breathing, and really so motivated by this work. Shanae is originally from New Jersey, so glad that we could have her on the Maryland line here. And then she also went through some schooling. She's got her master's degree from Johns Hopkins. She's also a community health worker, so she really knows a lot of the work that this coalition is so passionate about. So we are just so excited to have her expertise, and overall just her cheerleading for the coalition. So congratulations, Shanae. Welcome to the Prince George's County Health Department, and welcome to the coalition. We are so fortunate to have you.
Oh, thank you. That was really sweet. Thank you, Taylor. I appreciate the warm welcome, and everybody has been so helpful. And I know it's only been like a month and a half, but I know transitions take time. So I do just appreciate everyone's patience with me as I'm learning everyone and recognizing faces. I see some familiar faces from previous employment that I've had. It's always good to see familiar faces, but I love meeting new people too. So I'm just really excited for all the work to come that we're going to do together, and just the change that's coming. Good change for the community. So thank you, Taylor. I really appreciate all those kind words. All right. Well, speaking of change and transition, we have had a lot of that. So at this time, I would like to ask Olo to just come and provide our coalition members with some higher level updates regarding recent transitions to our leadership. Olo?
All right. Thank you so much. For those of you who, you probably know me at this point, but I'll introduce myself again. My name's Olo Olakemi. I am the Deputy Health Officer here at the Health Department. I've been with the Health Department since 2021, so going on 4.5 years. So I just wanted to start by, again, welcoming Shanae to this great work of the coalition. I mean, this is great work that we're doing here, and we need great people to help to advance this work. So we're very glad that you're here, working with us, and helping to do this great work within the community. I also wanted to thank Taylor for all the work that she has done and put into the coalition. And congratulate her again on her new position. She hasn't gone far, just down the hall, but I'm so glad to see her face when I come into the office. So that's really great. So I keep hearing the word change like so often here, and as they say in this life, the only constant is change. And we've definitely had a lot of changes here within the county in the recent future. The biggest is that we have a new county executive, Aisha Braveboy, and with that has come changes in direction, changes in leadership, and there's also with that has been changes at the health department. The biggest of this change is that our prior health officer, Dr. Matthew Levy, is no longer serving as the health officer. Currently, the county leadership is currently in the process of bringing on a new health officer, and I'm hopeful that that process will conclude in the very near future. Well, luckily for us, while this process is playing out, which often turns out to be longer than you think it will be, we are fortunate enough to have Dr. Jacqueline Somerville serving as our interim health officer. She regrets that she's not able to attend this meeting. She had a prior engagement that she was not able to, get out of. But she sends her regards, and she sends her appreciation for everything that all of you in the coalition are doing to advance public health in the county. But I want to just tell you a little bit about her. I know you can read. So I'm not going to go read off everything, but I do want to give up some highlights. Dr. Somerville has over 20 years of experience in behavioral health, public health administration, and policy development. Prior to being in this acting health officer role, she served as our associate director, overseeing our division of behavioral health and a number of programs working with children, working with youth and families, working on issues of addiction and addiction prevention. She manages all sorts of grants within the county, and she has a doctorate in clinical psychology, 2 master's degrees in clinical and counseling psychology, bachelor's from York College of Pennsylvania. She teaches at night. She does all sorts of stuff. I don't know how. Like, but we're very glad to have her, at the health department and helping us through this transition. So you will be seeing her in the future. She will, while as in this acting role, she will also be serving as the co-chair of the coalition. So you'll definitely be hearing from her. And if you want to learn anything more about her, there's also a full bio here in the presentation. And if you have any other questions, y'all know who to call. All right, thanks.
Thank you, Olo. I appreciate that. All right, well, we are moving right along, moving and grooving. At this time, I would now like to ask Deborah to share some updates around the community health assessment. I know this was, at least what I hear, this was a very involved process. A lot of effort and energy went into this work, and the report has been published. So if you haven't had a chance to look at it yet, please do. It is a phenomenal document. Those who worked on it worked very hard, and the diligent efforts are very evident in the product that was produced. So thank you to the team who worked on the community health assessment. But Deborah, please, feel free to jump on in and share a little bit about that process, some of the key findings and ways that we can use this report.
Awesome. Thank you so much, Shanae, and welcome again to you. Like Shanae said, my name is Deborah Collier. I work in the Office of Assessment and Planning, and I'm just happy to be able to share some of the key findings with you all, and then some of the ways that different organizations can also use the community health assessment. So first, I just wanted to, thank you. First, I just wanted to just discuss briefly the purpose and kind of background regarding how we produce the CHA, or the community health assessment. The purpose of the CHA is to support informed decision-making and foster collaboration to build a healthier and more resilient community that aligns with the health department vision. All Prince-Georgians are their healthiest at every age and every stage. This was a collaboration between county residents via the resident survey, community partners that provided feedback using our partner survey, key informant interviews, as well as our hospital partners, Luminous Health Doctors Community Hospital, Advantage Healthcare Fort Washington Medical Center, MedStar Southern Maryland Hospital Center, and the University of Maryland Capital Region Medical Center. And within the CHA, we also acknowledge our key informants as well. So thank you all so much for your participation. So we have discussed the National Association of County and City Health Officials, NACO, mobilizing for action through planning and partnership. I know it's a mouthful, but the MAP 2.0 process, I know we've talked a couple of times about it within the coalition, but we use that framework to kind of guide how we develop the CHA. So just a quick background about it. So the MAP 2.0 framework was updated from our previous MAP framework. But this 2.0 framework is working through a 3-phase approach, which emphasizes community engagement, as well as an incorporated 3 modified kind of data-driven assessments. And they're aimed at kind of telling a comprehensive story from both a quantitative and qualitative perspective. And so the diagram here just kind of gives you an idea of those 3 phases. The first phase, which builds the community health improvement foundation. The second phase, telling the community story. And then the third phase, kind of continuously improving the community. Next slide. So using a modified partner and resident survey and key informant interviews, we were able to provide the community perspective. We triangulated that with secondary data. I'm sorry, does someone have a question? Okay, sorry, let's just spend some. So we triangulated that with secondary data in order to identify and prioritize areas of focus. Next slide, please. Thank you. So from this triangulated analysis, we wanted to just kind of highlight some key findings. The growth of the population has fluctuated over the past 5 years with a 5% increase in the population from 2022 to 2023. There has also been a shift in the racial and ethnic makeup of the county with a slight increase in our Hispanic and Latino residents specifically. We've also seen an increase in the median income from 2018 to 2023. However, we've had 11% of our county residents that live in poverty. And then additionally, 40% of those county residents reported the overall health of the county to be either fair or poor. Some other key findings focused on social determinants of health and barriers to those social determinants of health. So first looking at access to affordable housing and jobs and wages, so that economic development were identified as priorities by residents. And during our key informant interviews, we also saw the economic stability and food insecurity were identified as emerging threats impacting the health and well-being of the residents in the county. We also saw higher rates of poverty compared to the state. And then an emerging and kind of growing concern among residents was public safety and specifically crime. Next slide, please. So this diagram here is the Agency for Toxic Substances and Disease Registry, which is the agency that's kind of tasked with determining and preventing and kind of mitigating the impact on human health due to like hazardous substances exposures. And so essentially the SVI, which is a social vulnerability index, is used as a planning index to determine the resiliency of a community before, during, and after a disaster, whether that's a natural disaster or a human caused disaster, but it's a way to kind of see the resiliency of the community during those times. So it was used during the pandemic to kind of determine equitable resource distribution. So when you think about vaccine distribution, as well as like testing kits and things like that. So it was also used during that time. The index comprises about 16 variables, including unemployment, poverty, education, housing, health insurance, and several other variables to indicate the communities with that, the greatest need for emergency supplies and support, like I said, before, during, or after disaster. So this is a map of Maryland, and then the colors kind of show the different levels of vulnerability. And so the levels are low, they go from low to high. And currently, Prince George's County is sitting at a high SVI, which indicates that we have a greater need for support during those kind of before, during, and after these type of disasters. And so again, it's just to let us know that, you know, and similar to, you know, like I said, during the pandemic, it's just to give us a way to plan better, to so that even in terms of like the federal government being able to know what, and the state government as well being able to know what resource allocations we may need, it gives them a way to kind of plan. And so it's used as kind of a planning resource as well. And I just wanted to just kind of let everyone know that, you know, these are just kind of highlights of the findings from the 2025 trial. There's a lot more in that document. And so I just wanted to highlight some of these so that we can try to use the trial to be able to create kind of a targeted and sustainable and equitable solutions that help improve health outcomes for our residents. And then we kind of talked about these a little bit already in one of the previous meetings, but the 2025 community health assessment priorities for 2025 were identified as a result of analyzing the community feedback and secondary data. So we have chronic disease, maternal and infant health, behavioral health, access to care, social determinants of health, and again, that focuses on the built environment and crime, specifically for public safety. So it aligns very closely with what the state health assessment priorities are, which are chronic disease, access to care, women's health, violence, and behavioral health. And again, the ones that we have for Prince George's County, they're not in any particular order. So it's not that, you know, one is over the other. They're all just priority areas of focus. And then how you can use this report. So the 2025 trial is currently posted on the Health Department's website. It's also on PGC Health Zone's website. And then accompanying those documents on those particular sites is a feedback survey, which helps us to gather information regarding how you utilize the CHA, and also to make sure that we're just including indicators that are helpful to create programs to better serve our residents. So I just want to take a quick minute to kind of mention how different kind of entities can utilize the CHA. So for like instance, county agencies, you can look at the indicators and spatial analysis to ask the question of, how can data sorted by age or race and ethnicity and location help target programs and provide a baseline for programmatic metrics. For community organizations, in terms of looking at the data from a lens of how could data and health findings strengthen your grant writing, reporting, and strategic planning efforts. And for our elected officials and county leaders, could ask the question of how could the CHA findings inform resource allocation, help set priorities, and spark questions about root causes that create differences in health outcomes. And then for our residents and faith-based organizations, as well as commerce or businesses, could just ask the question of, what issues identified do you want to work on? And then what could you do to help improve? Or how can you partner or collaborate with other entities to help improve health outcomes? So those are just a couple of ways that different entities can kind of take the information and the data that's included in the CHA and utilize that to help better plan for programs that better serve our residents. And then if anyone has any questions.
So if anyone has any questions for Deborah about the process or just some of the key findings, this is your opportunity to ask those questions. You are welcome to unmute and speak, or you can type them in the chat. And Ray is kind of keeping an eye on the chat box for me. Any questions?
Well, how do you plan to use this to make changes here in the county?
Well, I think the idea that we have data now that, similar to the other CHAs, I think this is a way that we can kind of now start to make data-driven decisions. One of the things that we've kind of talked about, as well as using some of the quantitative data, and there's qualitative data included here as well, but also looking at some other like root causes. We have the process of maybe wanting to look at a root cause survey and just trying to better understand some of the disparities that we're seeing, and then be able to understand why we're seeing them so that we can better target and create programs. So in terms of utilizing the data that's currently there, I think, if you're, for instance, we have different work groups that are working on different things, utilizing the data to kind of figure out where those targeted groups should be. So if you're going for different grant applications, just trying to figure out, okay, where are some of the disparities that we're seeing? Where are some of the inequities that we're seeing? And just kind of starting there and starting to use the data to better make those decisions. And I think that is a good place to start.
I'll just quickly add.
Sorry.
Dr. Cooper, I'm just going to cut you off real quick. I just want to add about talking about its use across the county. Involved in this community health assessment was basically every county agency. Every county agency is aware of this assessment. They were all involved, whether it be a key informant interview or they received a data request from Deborah. So all of our county partners are aware of this assessment, and we're trying to better triangulate how we are all using these reports. So planning, for example, they have Plan 2035, our HEAL work group. They're very familiar with that document. We now have a community health assessment, DSS, they have strategic plans. So we're trying to figure out how can we best use all of these documents as county agencies? How can we make sure that we are all speaking the same language, that we are aligning priorities? So planning knows that the health department is working to address chronic disease, and they can align their Plan 2035 indicator to reduce obesity. So that's what there's an opportunity there for this document to really cultivate collaboration across the county. But most importantly for this coalition is the Community Health Improvement Plan, a document that will outline the strategies that you all think are most important to then translate this data to inform. All of our hospital partners who are, some are on the line today and have been involved with us throughout the process, they will also create their health improvement plans. Our FQHC is the federally qualified health centers. They're also going to create health improvement plans in response to this community health assessment. So you're really going to see this assessment be the fabric of a lot of change and a lot of prioritization and a lot of what happens next in public health across Prince George's County. So this is not a one-time document. It is forever evolving, and we invite all of your comments and questions, and we invite you all to help us translate this data into practice moving forward.
And we have another question.
Hey, Deborah Taylor, this is Greg Taylor. Question: have the county exec weighed in on the priority for addressing the health issues of Prince George's County?
Not that I am, not specifically that I'm aware of. I think that she's, mentioned kind of broadly some of the priorities that she's interested in, but nothing specific. I don't know if Olo may have heard different, or Taylor, if you want to chime in.
Yeah, no, I mean, I haven't heard the specific key issues that she is interested in, but we've been working with her leadership at the deputy chief administrative officer level to look at a number of different priorities in terms of how do we strengthen behavioral health, how do we strengthen our reach out to folks who need nurse monitoring and assessments. We're kind of looking broad. Their focus right now is trying to understand the landscape of what we're doing and trying to figure out ways in which the health sector and the health and human services sector can better collaborate. So we're actually working a lot on like, how can we, what's the things that we can do with social services? What are the things that we can do better with the schools, with family services, and trying to see where there are points of integration. So they're not look right now, at least they're not looking at like, well, we're just focusing on diabetes or something like that. Like their focus is a lot wider on how do we have a system that works better and more collaboratively together. We may get to a certain point where we start to see more specificity and, they may have particular issues they want to focus on, but right now that's been their focus.
Okay, so no impact on the political ramification of impacting the health of Prince George's County. And I think that should be a number one topic that should be discussed or need to be discussed, because we all understand this political environment that we're operating in and the impact it will have on the health and human services of this county. And especially just reading something the other day about, we have a large percentage of our community population that depend on Medicare and Medicaid, and there's cuts coming down the line. So what's the impact? So that's why strategically, I think the county executive need to kind of give us the law of the land and how we plan to mitigate some of these issues.
Yeah, I'll definitely communicate that up the chain. Right now, we're really in the process of trying to assess kind of what we expect those impacts to be. So we're expecting impacts on our Medicaid population, who's going to have cuts. A lot of that we're trying to work with the state, because we can't fully estimate what our impact will be until the state kind of does their work at their level and see how that's going to impact us at the local level. I know that they're also working to see how, changes within the localities around us are going to impact us. For instance, the work that's being done around how do we shore up services for people experiencing homelessness, when we know many of them are going to be now coming over from the District of Columbia because of, the policies that are going on right now. So they are kind of actively, strategizing around what can we do, mobilizing resources, at social services and others to see, what do we have the capacity to do. But some of that's going to have to, play out when we get to a little bit more clarity around, what are the larger changes going on in the state.
Okay, got it. Thank you.
No problem.
I think there was a question in the chat box.
Yes. I think the question was answered. I was thinking about, we have a
11% poverty rate, and I just wanted to know if
if this area is targeted for like greater needs of healthcare for the chronic disease, behavioral health, do you make that assessment for those areas, the 10, 11% poverty areas?
I'm sorry, can you repeat that?
You mentioned that we have an 11% poverty area in Prince George's County. So I just wanted to know if some of the priority needs, if they are going to be targeted for that areas, to those areas.
So in terms of like geography, we will kind of do that kind of spatial analysis. We will look at zip codes that need to be targeted. And a lot of the grants already do that. So a lot of them do target certain areas for those social determinants of health. And so it won't necessarily be specifically just looking at poverty. There are a lot of other factors that would determine, like how we would address poverty, because there are a lot of the circumstances that feed into that, like we were talking about before with some of those, when we were talking about kind of root causes of things. So just kind of getting to what we, like what would be helpful and how do we target what needs to be targeted to actually make impact. I think that's kind of what that will come from. So it won't necessarily just be looking at like zip codes and specifically only poverty, but then how other indicators are feeding into that as well and how the circumstances are feeding into that. I hope that answers your question.
Yeah, and some of that's going to come out when we start going into our, we have our assessment and we go into our implementation planning for, how is this data going to inform what we're going to, do in our improvement plan. And I think that would be the point when we want to start to talk about how do we focus our efforts as much as possible. We know we don't have unlimited resources, but so how do we focus those efforts of all these folks working on these issues? That may be a point to kind of have that conversation and say, do we target interventions in particular areas, and how do we, as a team, believe is the best way for us to, have the most impact. So I think that would probably be the time to kind of start thinking about that. The CHA is going to give us the data, but we have to figure out what the plan is that'll get us the, the results that we want.
Okay, thank you. That answered my question.
Hey, that's a good question or comment you made on how do you plan to leverage the resources to get at the gaps that Sherman talked about. And I know that even when Dr. Levy was here on his watch, and we talked about in the past that pretty much the health department have exceeded its capacity to address the needs of the community. And that was prior to this previous election. So it was incumbent on us now to look at how do we strategize to leverage the community resources providers to address those gaps. And so I think that that's something that should be factored early on in the discussion or the strategy.
Yeah, I wholeheartedly agree with that. I mean, I think we're all here in this coalition because we realize we can't do this work alone. Like the problems that we have to tackle are too big for any of us to really address. And we have to have a team approach and a coordinated approach to be able to, really address these things that are, they're quite, even one of these areas that we want to try to, address is like huge. So I think it's, we have to work from that standpoint of collaboration and, collective impact and collective work together. So that's why the coalition is so important. And that's why this work has to only expand from here.
They're all great questions and great feedback. Are there any other questions? Ray, do you see anything in the chat?
We're caught up.
Awesome.
I cut off Dr. Cooper earlier. Dr. Cooper, did you have anything you wanted to add?
Well, I think you've all said everything that is important and vital to this process, the spirit of collaboration, and how these particular issues that have been identified have led to priorities. And now it's turning those insights into action And that's the beauty of the coalition that we have. We have such a diverse uh, enterprise of individuals and organizations that we can not only identify these particular problems, but be solution architects and looking at how we're going to strategize, leverage those resources, because we know collaboration is the key. Even if we look for funding, both on the federal level, state level, or local level, and even with private organizations, they're always looking for creativity as far as what is that strategy? Who are those particular individuals involved and organizations involved to bring this to fruition? And so again, as the ongoing theme that we're hearing, it's collaboration, leveraging those resources, identifying the strengths of each particular community partner brings to the table, and then working together to find solutions.
I'll also piggyback on that and also say that there's strength within the community itself. The community members are empowered, strong people, and they want to help their community. They want to help themselves. They want to help their families. And so, yes, community partners are important, but they are also our community partners. And I think sometimes we subconsciously kind of forget that. And so like they are the experts of their communities. They know what their community needs. They know the strengths of their communities, what the needs of their communities are. And we are the providers of the resources that they may have trouble accessing. So it's like, making sure that they are also at the table with us. It's not just the leaders of these community organizations. It's not just the leaders of community partners, but that community members themselves from every background, every population group you can think of, are also represented at that table, and not just sitting at the table, but also eating from that table and giving their insight and giving their input. And I think that will be when we see the greatest difference in the health and wellness of Prince George's as a whole. So that's just my little tidbit, my equity hat. There you go. But thank you all for your feedback. If there's no other questions, I think we can move on. Give it a moment. I see nothing. Okay, great. Well, let's move on. We have some exciting updates from our work group. Our wonderful co-chairs are going to share some of the updates, some of the things that they've been working on, their most recent work efforts, and we'll kind of just go one by one. But we will first start with our Behavioral Health Advisory Group, or our BHAG. We have our wonderful co-chairs, Margaret Fowler, Nina Ward, and Carlos McCall. And I'm going to open the floor to Miss Margaret to share some of the updates from BHAG.
Thank you, Shanae. I just wanted to also chime in a little bit about the community health needs assessment. I think you guys have done a wonderful job, and really it is, like Olo said, it's the beginning of how we all can synergistically work together and really create an integrative community coordination care continuum. Because I think what we're going to find is, you not only have, there's these priority areas, but people are in all of those priority areas. They're not just in one. So that we have to build this continuum and do these warm handoffs. And I think that's what I'm really proud of, to be part of this coalition group and part of the advisory group, because each one of our advisory groups also dig a little deeper based upon the necessary, what we're looking at. But behavioral health could then be related to chronic disease. It could be related to maternal child health. So it's great to see, and it gives us a focal point, and it allows us to start there and figure out how we can work synergistically together in creating this implementation strategy. And that's sort of what we do with the Behavioral Health Advisory Group. Just wanted to share a little bit about, and maybe another little trivia question as far as the CHNA is concerned, is like, did you know that the behavioral health provider list is the most visited page on the Prince George's County Health Zone? And as you can tell, that was one of the priority areas, behavioral health. So it aligns. So it helps us be like, okay, what do we need to do to improve that? And then we talk about those things at the BHAG group, and we come up with these ideas, like how do we improve that access to that page? What else needs to be there? So we work with the providers and saying, go in and make sure that it's still accurate information, because we want people to go there, they're going there, but if they don't have the right information and it's not correct, what do you think is going to happen? So that's one of the things that we can do as a group. And so that's what we're doing as an advisory group for the behavioral health component. We also, again, the strategic alignment that we're going, we had 21, 22 goals and objectives based on the old CHNA. Now we're going to start really aligning new goals, and how do we help the and develop the implementation strategy, and aligning with all the other components that are in the health department and the LBHA, and even with some of the other work groups that we're going to hear from earlier or later on in the presentation. And then we do a lot of presentations about new programs and services that are being brought to the county that allows the providers to say, oh, wow, I didn't know. And then again, linking those opportunities and maximizing the use of what we do have in Prince George's County. And then what's really important too is that we provide a spotlight for all the providers that we have. So as new people come on, they get to hear what the providers are doing and all the resources that they have. We're able to also identify again what things are not, who's not here, what do we need, what's missing, and we help reach out and bring those individuals into this advisory group to make sure that we have a voice for what's not being heard. And then again, improving just communication across all those service lines and making sure that we're getting things right, and then going back to making sure that it's documented somewhere. And then we also ask other counties to share with us what are they doing. We don't always have to reinvent the wheel, so we've asked other counties to help us know what's going well with them. And so that's sort of where we're trying our best to make Prince George's County the best it can be. And then utilizing all of our resources synergistically and working together with all of the providers within the behavioral health space. And I am, honored and privileged to be able to work with Taylor and now Shanae, and then working with Nina and Carlos. And, we hope that we can, again, just be very instrumental in helping to bring more behavioral health services to Prince George's County.
Thank you, Marcy.
You're welcome.
Yeah, BHAG is doing some really incredible work. And you're gonna hear me put in the plug. If you are interested in learning more and want to be a part of, just kind of join a meeting just to see what we're all about, please do so. We welcome you and would love to have you. So feel free to join us.
And I'll just put a plug in. It's the third Wednesday of the month from 3 to 4:15.
Thank you. All right. Wonderful. All right, well, let's move on to our next work group. We have our community care coordination team. So we're going to hear from Ms. Tornisha Stokes, but we have our wonderful co-chairs, the wonderful Dr. Ernest Carter. If anyone has had the pleasure of meeting him or speaking with him, he is a wealth of knowledge. And then, of course, Ms. Tornisha Stokes, who's fantabulous in her own right. And then Ms. Caitlin Murphy. But Tornisha, would you like to share some updates from the CCCT?
Hi, everyone. Good to see everyone today. So for CCT, we really focus on community care coordination. So over the last year, we have various guest speakers to come and share some of the challenges. So we had DSS to come and present, also EMS, and Hazel Health. And so just starting with also DSS. So one of the things that was a challenge for DSS was reviewing the panels, the homeless panels in Chris. So we actually try to coordinate a meeting with Chris to see how they can get access, how even the health department can assist with viewing that information. They wanted to focus on improvement in the communication flow between the healthcare and homeless service as well. So we always looking to see how CCT can help, what resources the community needs, the residents, and how we can make that connection and making sure they get to the resources. And also for EMS, they have like the high frequencies always calling 911, so the mobile integrated health project. They get a lot of calls, so they go in the homes to see what's wrong, how we can help people eliminate those calls, or go into the emergency rooms. And so usually they really need assistance, like with community health workers, to get the patients connected to various resources. During the time that they work with Prevention Link, we saw a lot of the patients needed like home health care, nursing assistance. So that was one of the needs. So we just always, as I mentioned, looking to see how we can get the different community partners the resources that they need. And with that being said, one of the things that we also talked about was like Find Help, the platform. So we looked at different community resource inventories. So we had Find Help to come in, present 211. We also met with Chris, as I mentioned. And so overall, as a group, CCT, we decided to move forward with Find Help. And I think Behavior Health was also looking to create that inventory of mental health providers. And so what's very important with Find Help is that each organization make sure they claim their organization, because sometimes the information is not updated, or, all the information is not listed. So we wanted to make sure the community members are going in, making sure their organization is listed and claiming their resource. And we actually had a partner from Howard County to come and present the great work that they was doing in Howard County, which we would like to replicate here in Prince George's County. And then we always hear about population health. And so we're big on population health in the CCT work group. Work group. So we're definitely looking to see how we can move that forward with building that population health and health improvement model. And so our last meeting was talking about trusted communities. What does that look like? And so that was a rich discussion. We're looking to continue that discussion. So we want everyone on this call to help us move towards building this population health improvement model. So please join our CCT meetings, which is on Thursday. And forgive me, tell her no the exact Thursday of the month. So I'll
Fourth
let her say it.
Thursdays.
Yeah.
Fourth Thursdays at 3 p.m. I know I'm trying to keep them all in my head organized.
Yes, and Shanae.
Awesome. Thank you so much, Tarnisha. Yes, please feel free to join us at our monthly CCCT meeting. Again, lively discussion that we've been having, with greater discussion to come. And I think just talking about community kind of speaks to what we were all alluding to earlier, as far as working together, having more synergy to address these great health needs that we're seeing, especially with the change in administration and cuts coming. There's going to be a lot of change. It seems to be the theme of today's meeting, is just change, but change doesn't have to be scary. It might be a little uncomfortable, but it doesn't have to be scary if we can plan accordingly and work together to address the change. So please join the community care coordination team on the fourth Thursdays at 3 p.m. All right, moving on. We have our Healthy Eating, Acting Living, or HEAL work group. So we'll hear from Ms. Devin and Ms. Jessica, who are going to share a little bit about the work that we've been doing with HEAL.
Hey, I'll start off, and then I will turn it over to my partner, Devin. Good evening, everybody. So thank you again and I see I will speed it along. I see the time. So I will make sure I will make it quick, so just kind of want to go over what we've been working on as a committee. Oh, thank you. Thank you, Sinead, for, and just for healthy eating. And of course, HEAL stands for Healthy Eating, Active Living. So for our plan 2035, we've facilitated the presentation with Parks and Recs, and we've been working on our 5-year update. So that is constantly being updated, and we are still working on kind of like evaluation and kind of the metrics and what exactly that's going to look like, and then promoting the alignment with other county agencies to making sure that we all are looking at different agencies across the board, not just alongside with Parks and Planning, just to make sure that we're aligned with what the vision looks like as we move forward for 2035 for HEAL. We want to make sure that as we're heading towards a more healthier Prince George's County, that all the agencies that everything in the vision is truly aligned across the board with all of the different county agencies. And of course, we always have room at the table for additional agencies to come on board for the HEAL committee as well, because we definitely would love to get some additional feedback as we work together towards the plan. For the health and wellness observance, we have our CPR awareness plan. So CPR, putting my hat on with the American Heart Association, is really one of our key focuses. One of our key missions is around CERP, so our cardiac emergency response plan. So making sure that everyone's aware that not just emergency plans are in place, but we also have cardiac emergency plans. So you know what to do in case anyone has any type of cardiac emergency along. We're working to hopefully implement that for any organizations that are interested and don't already have that as part of their emergency response plan. And also the other thing that I wanted to add that's not on here, we also, for organizations that may not be ready to have a cardiac emergency response plan, but would like to have us just have like a CPR plan in place. So just maybe have a CPR training policy in place. We also would love to work with, we also are able to work with organizations who want to just have a training policy in place. So even if you don't have one in place, or maybe have the kind of like the elements and just kind of want to get it, how to get it implemented and what exactly one would look like, we definitely can help you get that. We would love to work with you to get that going as well. And we have the template, and we would work to make sure that you have who you need to get certified and who needs to be trained for bystander CPR as well. Also keeping partners informed about all existing health and wellness resources. So again, like I just mentioned, all of the tools and resources alongside our health and wellness, all the agencies and all the partners that are part of the HEAL committee. And we want to just make sure that all the resources that we have are that everyone throughout the county are aware of it, and making sure that everyone has access to that as well. One of the most, the legislative update that we're actually kind of just at the beginning, but it's going to be moving fast and furious, is the Senate Bill 151, which is the health and wellness, under the health and wellness work group. It's the County Bill 67. The food is medicine, which is also with the food and medicine work group, which is going to overlap, that it's going to be coordinating a lot of these initiatives that actually I'm going to be part of. And that is going to be, gosh, I want to say it's going to be fast and furious between now and November, because it's going to be coming upon voting. I want to say in December, I think they're going to be voting on to see if it's going to be part of the legislation. So I think we're meeting tomorrow. We have a meeting to see how that, so more to come to that. Last week, which is our first, I think it was last week, which is our first in-person meeting around that. So we are going to be looking at just different ways that we can kind of implement a lot of the when we were looking at diabetes and a lot of the initiatives that we're working out in the county, and how we can get a more kind of like a more streamlined process when we're looking at across the board, when we're looking at clinical partners, when we're looking at hospitals, and how we can get those as part of implemented, as far as when we're looking at social determinants, and how we can get those implemented like in electronic medical records, and how we can get that as a referral and get that more streamlined. So more to come with that information. And then finally, one of the successes that I want to mention very quickly, is around the implementation that we had with our healthy food and beverage, which is another one of our policies that we had with our partner here, that I'm going to actually turn it over to in a second, Devin, with our with Prince George's County Parks and Rec, that we were able to, about 2 or 3 years ago now, we were able to implement healthy food beverage guidelines through all of the parks agencies. And again, call to action for any other organization that might be interested in doing that as well. We would love to work with you. So now I am going to turn it over to Devin to talk about parks and recreation resources.
Thank you, Jessica, and good evening, everyone. I just wanted to briefly share information about Parks and Recreation resources. The MNCPPC Department of Parks and Recreation, Prince George's County Fall Guide is now available. This is our seasonal guide resource for information on fitness classes, nutrition programs, events happening out throughout the county. Whether members are looking, or community members rather, are looking for special events or just something to stay connected. This is their resource to be able to do that and find information there. You can find details on a wide variety of offerings at nearby community centers, making it easy and convenient for people to stay involved. So please explore the fall guide and stay connected with everything that we offer. To view the guide, please visit at the pgparks.com website. And we encourage everyone to take advantage of these great resources. So, thank you.
Great, thank you. So as you can see, all of our work groups are doing really incredible work. So I really appreciate Devin and Jessica for sharing that. And lastly, we will hear from our health equity work group. We have Ms. Christine Stewart and Dr. Sharon Gibbs Cooper. If you are here and want to share a little bit about what the health equity work group has been doing.
Yes, Christine, are you here as well? I'll get started. Good afternoon, everyone. Good evening, that is. I am Sharon Gibbs Cooper, co-chair with Ms. Christine Stewart. It's been a pleasure working with the health department. Taylor, Shanae, you've been wonderful, along with the other community providers that we've been working with. Before I highlight what we've been doing and what we've accomplished, I would like to give you just a little snippet of who we are and what we're about. The strength of our group is our community connection. We are rooted within the community, and we are committed to the pillars surrounding public health and building a sustainable culture of health. And that, of course, is contributing to knowledge as well as building insights which lead to action. Our group consists of a collaborative framework, which consists of community stakeholders and our thought partners and leaders from various enterprises, such as our respected community members, our public health professionals, such as the health department, along with our community health providers, academic institutions, and of course, our community hospitals as well. With today's changing landscape, we're forced to look at not only the political and economic aspects, but also the dynamics that we have to take and strategies that we have to utilize in order to create that path to equity. Our work group consists of solution architects that work diligently and around the clock in looking at or digging into the science surrounding equity and translating those insights into action. We, like the other groups, we have what we call bold conversations and spirited conversations with wonderful outcomes. And I found just through all this and the presentations, there were a lot of overlaps in some of the groups and the presenters and along with the participants, which makes it a more meaningful and enriching experience for all. We work to bridge those public initiatives that bridge gaps in equity that have been accelerated or we call amplified during the COVID pandemic. We know we have an infrastructure that's fractured, but we go and we look at solutions. We look at ways that we can work collaboratively and provide not only our voices, but we represent the lens of those who are directly impacted by the equity, lack of equity for our communities at whole. Let me just highlight some of the things that we have done in the area of public policy, legislative updates, speaker engagement, and other what we call collective efforts. As far as public policy, we entered into the realm of advocacy. And as we know, with the latest, again, cuts in Medicaid and cuts as far as funding and competitive priorities, we at the county level had suffered a major cut. And with the work of Health Assurers advocacy, those efforts, and basically testifying in front of the county council And it was not only our group members and our what we call professional organizations that are a part of this, our community stakeholders, but our individual stakeholders who are directly impacted by such services offered by federally qualified health centers. We also had other, community leaders that showed the impact, and working collaboratively, we were able to convey that message to the county council and get the proposed 1 million up to $2 million. No, it's not where we want it to be, but it's a move in the right direction, moving that needle in the right direction to make sure the voices of our communities are heard, not only from those who are on these work groups, which are our members from the community and other enterprises, but the opportunity to hear those individuals who are benefiting from such programs as well. The other areas we looked at would be policy and legislative updates. And I hear other groups in this same realm. We were blessed to have Stacy, or not Stacy, I get the names mixed up, Stephanie Little from the health department. She comes on a regular basis to provide us updates as far as how these cuts or any political changes will affect those particular areas that we're targeting as our priorities as we go through this changing landscape. Also, with those Medicaid cuts, what are the proposed actions that we need to look at? What do we have as far as leveraging the current resources, and how do we work outside of our community or work group in order to identify those particular gaps and close those gaps? In addition, we have speaker engagement. And like with some of the other groups, we have had Chris come to speak for us. We've had a Find Help. And I must say that Find Help has been very important and played a vital role. Not only have we used it here, but I was able to offer that resource with some family members and friends and colleagues in Southern California during the fires. So these are just resources that we can share not only within our county, but also we see it at work in other jurisdictions and states. As far as other speaking engagements, we've had individuals that will be coming in tackling some of the priorities that have been discussed during this recent and historical community assessment relating to maternal and child health. And then looking at those initiatives again, how do we bridge those gaps? How do we improve those outcomes? And how do we make sure that we have what we call, those particular strategies that are sustainable and that are dynamic and that can be transferable, not only during this time, but in the future times as well. We work towards empowering our communities through culturally navigation and support and training. And that's all going into that whole realm of that wraparound services, not only the medical, but we look at health literacy. And what did we do? Through this work, we've been able to develop curriculums through, and it escapes me now, health equity champions and health navigators to help be able to provide messaging that is so critical in addressing one of those areas of what we call the public health pillars. We make the information, and again, we make the information so that it's digestible. And what I mean by that, it's in layman's terms, and that the particular website is easy to navigate. And of course, it's dynamic. So we're going to be revisiting this to make whatever updates that we need to make. And working with other community partners and within the community, then we have those resources to make sure that it's, again, presented in a language that is appropriate and culturally acceptable. We advocate at multiple levels in sharing stories of real impact. As Shanae had mentioned earlier, we are the community. Not only are we communicating and articulating thoughts through the lens of their eyes, but we're also meeting with them. We're inviting them to the table. We're hearing their voices, whether it's advocating and speaking during the county council, or whether it's, having us speak on their behalf. But part of what we do is bring their particular needs to the table and try to address them through creativity, bold conversations, and strategic plans. We look at what's going on with the continuity, the work group, and continuity and coordination of care. That's all part of this social determinants of health, because we know all these things are interconnected, and having access to those resources are vital. in order for individuals to achieve ideal health and to improve what we call health outcomes for this particular county. And that's what we're trying to do as a whole coalition, as well as within this work group. We are tasked with doing so. As far as the future, what we're looking for, if you have a curiosity to learn or explore new ideas and turn insights into action to transform those lives, we invite you to join us as part of the Health Equity Work Group. And our upcoming meetings, again, we will be looking at this information provided through the community health assessments and look at how we're going to prioritize and tackle those areas, such as, what we talk about, advocacy, being able to, look at ways to get funding, all those areas. And we know that through our diverse groups and membership and future individuals who are going to be joining the group, that we can bring this to fruition. So thank you again for the opportunity to be a part of such a wonderful initiative. It's just been a pleasure working with the individuals within the Health Equity Work Group, as well as with the county and all the other individuals through this health coalition. So thank you for all the work that you do.
Thank you, Dr. Cooper, for sharing. We really appreciate that. And to our point, we welcome more voices. We welcome more people to have a seat at the table with the Health Equity Work Group. So if you are interested in joining us, we meet on the third Thursdays of each month at 3:00. And I just realized that I forgot to mention when the HEAL Work Group meets, and that's the first Wednesdays every other month. So that's our only work group that is bi-monthly. Okay, so thank you again. All right. I did just want to take just this moment to extend my gratitude to everyone who is a part of the Health Action Coalition, to all of our partners, to our community residents. I know I'm new coming in, but just hearing about all the work that you all are doing, it is very exciting. It makes me feel very enthusiastic coming on board with you all. So thank you just for your continued diligent work efforts to make sure that the health and well-being of our county is as best as we can make it. We appreciate you all working so closely with us on this coalition, and I do truly look forward to learning more about each organization that's represented, to all the community members who are so graciously giving of their time to work with the coalition, and just growing our partnerships over time, again, especially as I transition into this new role as the coalition manager. So thank you, everyone. If you are interested in joining one of the work groups, I know we mentioned when we meet, but here's just a quick slide so you can see it all in front of you. Feel free to write this down, take a quick picture with your phone, but I will make sure to share these slides with everyone later this week so you all can have this information readily available. And again, we welcome everyone to our work group meeting, so please, please, please come and join us. All right, so let's move on to the community announcements. We are coming down to the wire here, so I appreciate everyone hanging on with us a little longer. But let's start with our vaccine clinics. As a coalition, we do want to encourage our families to attend the Prince George's County Health Department back to school vaccine clinics. They started August 6th, but they will continue through the end of this month, so through September 27th. Again, there are a variety of clinics at multiple locations. Some are on weekends, some are during the week, but there is flexibility and availability. So the flyer is on the slide, and I will make sure to share that in the link with this presentation after the meeting. We are also excited to share information about the upcoming Medicare open enrollment event. This is being hosted by the Prince George's County State Health Improvement Program, or the SHIP. This event is a wonderful opportunity for people to learn more about their Medicare benefits. They can learn how to complete a benefits checkup. They might be able to receive one-on-one assistance if they have any questions or any concerns. They can meet with someone to get that warm handoff to get that assistance. And then there's ways to explore how they can save a little more money on healthcare costs. And we all know we want to do that. So if you are interested or know anyone who might benefit from this event, it takes place on Friday, October 10th, starts at 10, and it will be at the Health and Human Services building. kind of on the note of Medicare, Dr. Gaspin is the director of the Hopkins Center for Health Disparity Solutions with the Johns Hopkins University Bloomberg School of Public Health. I should know how to say that because I went there, but that is still a mouthful. But he is looking to speak with Black and African American Medicare beneficiaries in a 30-minute phone interview. He's really just trying to better understand what influenced their decision in their health plan selection. So if you or someone you know might be interested in participating, please feel free to share this flyer with them. I can email it to you if that's easier for you. But if you participate, you are also eligible for a $25 gift card. So again, just please share this wonderful opportunity to provide some insight to those looking to make a difference in the community. The American Heart Association will also be hosting their Heart Walk on Saturday, November 1st at the National Mall. So please feel free to register to join. This is a family-friendly event. I think you can bring your dogs or something like that. So if you have any furry pets, bring them along. It is a 1 to 3 mile walk for a great cause. The QR code is on this slide as well as the website to register. It is free to register. But again, I will make sure this is available to you by the end of the week. And finally, September is Hispanic Heritage Month. The Department of Parks and Recs is inviting everyone in the community really just to honor the vibrant traditions, the history, and the cultural contributions of Hispanic and Latino Americans. So this is a month-long celebration, although we celebrate Hispanic heritage all year long. But there will be lively interactive activities, live music, traditional dance performances. I think there's some art shows going on and a whole bunch of other family-friendly events. So you can visit pgparks.com to learn more. Devin, I don't know if you wanted to add anything to that, but you're welcome to at this time. Or if anyone else has any other community announcements that they'd like to share, I am happy to open the floor at this time.
I have a few community announcements. I now get to wear my health and wellness hat. Usually I'm on the other side of this presentation, so bear with me. But I am happy to announce on behalf of the Prince George's County Health Department's Health and Wellness Division that we are holding a diabetes self-management program. So this is going to be a 6-class series for anyone who is diabetic. They're going to get to learn some self-management techniques. It is a free program that is available to community members. It is starting Monday, November 3rd. That class is going to be taking place from 4 to 6:30 p.m. It's going to be virtual, so folks can access it there. Again, 6 sessions, all going to be free. So if you know anyone who is diabetic and looking for some self-management techniques, please send them our way. I will make sure that Shanae gets the flyer and is able to share it out with you all. One more update from me. You heard our HEAL work group gave an update regarding the Maryland General Assembly passed Senate Bill 151, establishing the Prince George's County Health and Wellness Work Group. That work group kicked off 2 weeks ago. A report is due by the end of the year. So there is a new health and wellness report that will be coming your way. But we could use the support of all of our coalition folks, all of our partners in the room. We need to create a landscape of health and wellness initiatives across Prince George's County. So I'm going.
You're muted, Taylor.
Oh no, I hope you guys didn't miss that. So if folks wouldn't mind sharing this survey link that I just put here in the chat with your networks. Again, we need to know of any health and wellness resources that are in Prince George's County. So these are resources that promote healthy eating, active living, chronic disease prevention and management. Again, we are creating this county level report with recommendations on how to address chronic disease and a lot of the health challenges that we see in the health and wellness space. And so we need your input. We need to know your expertise, who you all work with. So if you can share that with your networks and add any resources that you know of, the work group would greatly appreciate it.
Awesome. Thank you. Any other community announcements?
Yeah, I'm Marlene Orante from Hathaway Center for Health Literacy, and then I just want to let you know that the Maryland Consumer Health Information developed a Maryland Health Literacy Organizational SEAL program. So this SEAL is just to recognize states and local agencies that prioritize clear communication with the public. So take advantage of this. Please review all the information that I dropped to the chat, and then you can apply for the seal number 1, number 2, or number 3. Thank you.
Thank you, Dr. Arantes. Any other announcements?
I did have one thing that I
Hi.
wanted to kind of mention. I'm so sorry. Just really quickly about our Mental Health Awareness Week that's coming up in October. This is going to be the first week of October. I apologize. I don't have the flyer with me, but I will share it in the chat and I will give it to Shanae. So maybe we can pass that out to everybody. So that's our Mental Health Awareness Week that's coming up soon in October. And then also our Walktober observance. It's just a month-long observance in October where we have, we just encourage people to get out in the community and walk and get their steps in, but I'll be sure to share all that information with Shanae to make sure everybody gets that. So thank you.
Thank you. I think I heard someone else chiming in.
Yes, good evening. This is Jessica Gamero from MedStar Southern Maryland. I would like to make the announcement that we do have a diabetes support group. It meets monthly on the third Wednesday of each month. It is in person from 11 to 12 at the hospital. I do have a flyer. I can send it out and you guys can distribute it to whomever is interested, not just diabetics. Anyone who wants information on preventing diabetes as well as their caregivers, they're all welcome to attend. And then our second announcement is the hospital. We do have our advisory task force meeting Monday, September the 29th. It is virtual. It's at 4 p.m. And we invite any community members, any community partners who are interested. We will report out on our community health needs assessment as well as what we want to hear what we could be doing better on our implementation side as well as where we are with our implementation plan. So I can also share that link and that invite, and then you all, if you all can please share that with everybody in the group, that would be great. We would love everybody to come and join and just let us know how we're doing. Thank you.
Awesome. Thank you. So much great work going on in the community, right? I love this. Any last minute announcements, updates? All right, well, if nothing else, then I do want to remind you all that our next full Health Action Coalition quarterly meeting will be in person on Tuesday, December 9th from 6 to 7:30. So we'll make sure that more information comes out as we get a little bit closer to the date. Of course, we look forward to seeing you there as well as at our various work group meetings, so make sure you come. But before we sign off, I don't know if Olo has anything else you want to say before we close out, or Taylor, anyone else from the team?
Just again, thank you for being here. I know you all are, the coalition is great work to do. I know we're not paying you to be here. This is, but it's powerful that you all are here anyways, doing this work here in this meeting and your work groups. I think that's a testament to just the dedication of all of you folks who know that this is important work, who know that we have to work together to get there. So I just want to thank you all for being leaders for the community and taking your time to do so. So I want to appreciate you all and wish you a good evening.
Awesome. Thank you. And I also just kind of want to piggyback off of that. I know this was my first quarterly meeting, but you all made this a wonderful meeting. And every time I meet with you all, I'm learning so much more about what we're doing in the community. So just thank you for your patience with me, and please continue to send that patience to me. But just looking forward to all the work that's to come. I really appreciate you all just putting your trust and faith in me to lead this awesome coalition. And on that note, I don't know if Dr. Little is still with us and if she just wants to give our official close.
Yeah, I just want to echo what Olo said about the dedication, the passion, the willingness to give your time, and I am so excited that there is a diabetes self-management program going on in this county. So needed. Awesome. I'm excited about that. And I also want to make sure that if you did not upload a flyer or a link or whatever to the chat, to please be sure to send your information to Shanae, because we can make sure that we send it out to the coalition, because while there may be a few people on this call, there's great numbers of us who actually who are signed up to participate in the coalition, and our idea would be to share that information so they could share that among their network as well, so we can get the word out, because it's so important. You all are doing such great work, and there's so much exciting activities going on in our county. We have to get the word out. So please do share and have a wonderful evening.
Thank you all. Have a great night.
Thanks, everyone.
Take care.